Hey everybody, decided to make a video for a question that I've been getting asked of myself pretty often, and that question is, what does it feel like to go through chemo? Generally, like, how does my body feel? What do I experience? What symptoms am I going through? And I feel like that's such a difficult description to try and get across in just a written formation, so I decided a video might be appropriate. This is Breast Cancer Awareness Month, so if you don't know my story, I am currently fighting breast cancer. It is a HER2 positive breast cancer, so it requires additional medicine and treatment, and possible further treatment after a double mastectomy that I will have later on this year. But before we get into that, I thought the best way to describe and get into how chemo makes me feel is very briefly describe what I've had to experience up to this point, and then I'll get into like the symptoms and feelings and overall body experiences that I have during chemo from there. So, if you don't know my story or haven't been following my posts, I found a lump in my breast back last fall. And I went to the doctor to see what that was about. They did a mammogram on me for the first time. I was 39 years old. Typically you don't get a mammogram until you hit the age of 40 is when they suggest starting getting a mammogram. And they gave me the option to do the biopsy at the time or not, or wait until my 6-month appointment to do the biopsy. I could have done it any time before my 6-month checkup, but I decided to wait. Mainly because I was a little bit in denial that it could be breast cancer at the time, considering my mom has had benign lumps, and so I thought that might be the case for me. So on my 6-month checkup, they did an ultrasound, and the radiologist, after looking at the ultrasound, noticed that the lump grew. So his suggestion would to be do the biopsy as soon as possible. He suggested that day, and I said sure, even though honestly I wasn't emotionally ready to handle that news or that procedure, but I did anyway. Honestly, not too bad. And then after the biopsy, did another mammogram because they put a little clip where they do the biopsy, and they do the mammogram to make sure that the clip is in the right spot and they know where that is and everything along those lines. So mammogram again, just in the side that they did the biopsy on. And then after that, I got my results from my family doctor as to the fact that I had breast cancer. So then after that, then I had to get hooked up with my oncologist, and I go to Jenny Edmondson in Council Bluffs. I see Dr. Hussein. And I also get hooked up with my surgical team, because with most breast cancers, that's going to require some sort of breast cancer removal. And I see Dr. Bendorf for that and his surgical team. So I haven't talked with them in too much detail yet. It was more of a rundown of information as far as what the surgery would entail, what it would look like, what my options are, was our first meeting. I'll meet with them again after chemo is done to get a more detailed information about what my future surgery will look like. So then the process of putting in a port was done. If you don't know what a port is, it's a little device that they put, mine is right here, I'll show you briefly. There's my port. The port is put in to make it easier for any sort of blood samples needed when I do my labs, and also that's where the chemo goes in. So it's hooked up to a major artery that flows into my heart, and then my heart pumps it to the rest of my body. So the port was installed. That is supposed to be a very basic procedure. Only takes a couple of hours. They do put you out for it, so that was the first time I've ever been put out. And I had a complication. If you don't know my previous story, they nicked my lung and my lung collapsed. So I had a additional procedure and doctor visit and hospital stay to blow my lung back up. Very painful, do not recommend. So there was that. Then I had many, many tests before chemo could even start. Some of those tests include an echo, a CT scan. Honestly, I can't remember all of the tests I did. There was many. But they do everything they can to kind of check and see what sort of chemo drugs in process and amounts and all of that need to be done before you get started. And then they analyze all of that information. You talk with your oncologist and figure out what's the best treatment for you. If you want to know more about those scans and those tests and those procedures, you can see my previous posts. I won't get too deep into that. So then here we are at chemo. So for my first session of chemo, obviously I was feeling pretty good because I didn't have any medicine effects before that started. Did my first round. So my first round of chemo, you are supposed to take a steroid pill the day before chemo. And then during chemo, you go in, for me, and again, this is different for everybody, depending on your cancer treatment. So this is what I have to do and what I experienced. But for every cancer, even every breast cancer is different. It's not the same across the board. And even if someone who has the same kind of breast cancer I have, their level of care might be different than mine, just because they're a different person, different health situation, whatever the case may be. But so what I have to do is the day before my chemo, I take a steroid pill, and this is to help prep your body for any symptoms or side effects that the chemo might do the following day. And so it's kind of getting your body ready, it's prepping it. And then the day of chemo, I go in, I prefer to go in the morning because my chemo takes pretty much all day. So when I get there, I have to do lab. So they pull blood samples out of my port. They test those, and then while they're testing those, I talk to the doctor about any questions I might have. They check my vitals. They talk to me about any symptoms I might be having, anything like that might be helpful for that day. And so by the time that visit gets done, then they have all of the information from the labs to see if any adjustments to my medication might be needed. And then I sit in this kind of lounge chair, and from the lab, they already have kind of a tube hooked up to me, so they just connect all of my medicine to my tube, and then the medicine can be administered. So I get a lot of chemo medication because of the type of cancer that I have. So they hook you up to a saline bag, and so that's just helping kind of help the flow of the liquid through, and they also just turn on saline in between each of my medicines to kind of flush out the system before they switch it. And so the medicine I have to get is, I do steroid first, in liquid medicine bag form, not a pill this time. They give me anti-nausea medicine. They give me 2 types of immunotherapy, which is battling that HER2 protein that is mutating, that's causing my cancer to grow faster, and also makes a shell over my cancer cells that's harder to get to, so it breaks up that shell, so the cancer chemo treatments can be more effective. And then after those 2 immunotherapies, then I get 2 different types of chemo treatments. So it's total of 6 medicines that I get on my chemo days. And plus my saline bag. So that's a lot of liquid. It's a lot of chemicals that get poured into your body that day. Now, I just finished my chemo day 5 yesterday. I have 1 more to go, hopefully, is all I have to do for chemo, and that will be October 28th. Up until this point, except for day 1, I've been driving myself home after chemotherapy, because after that first session, which my husband stayed for just because we weren't sure how I was going to feel after that first chemo treatment, he drove me home. But we discovered that I didn't feel too bad, at least not so bad that I couldn't drive home. So I've been driving myself home after each chemo session after that. Typically, on chemo day, right after, you're feeling kind of, or at least the way I feel, is like a weird, like medical drunk is the best way I can describe it. It's not a fun drunk, like when you go out drinking with friends or socially or whatever, but you just feel very drug heavy, and you feel loopy. You feel not quite yourself. Still functional, still can talk to people like a normal human, but you just feel, I don't know how to describe it. You don't feel like yourself. And that's been true of every chemo day that I've had. And it gets worse as you build on the chemo treatment. So I've been very nervous about these last two because I know every time I've done it, you feel a little bit worse every time you do it. And your symptoms are somewhat consistent, but your symptoms also get worse as you do it because you're building on the previous treatment. Your body still hasn't totally recovered, and then you do it again. So yesterday I was feeling very kind of loopy, very drugged, very tired this time, which I haven't been quite this tired after chemo the previous times, but this time I went to bed at like 8 o'clock, and I was laying down even before that. And right after chemo, I went and laid down, read a little bit, got up, ate some dinner, talked a little bit, hung out, went back and laid down, and then went to sleep around 8 o'clock. So I was pretty wiped out. Last night I was, I had two major symptoms. Of course, after you do that many liquid medications in your body, you feel like you have to pee all the time. So I kept waking up to do that. But I've also, since about the third treatment, been experiencing hot flashes, sometimes during the day, but more often at night. And last night I had a lot. So I had maybe around 5 hot flashes, which is super fun if you've never experienced that. You kind of feel like you get a quick fever, and you get really, really hot, and you feel like you're really uncomfortable and you're sweating a lot, and it only lasts for a couple of minutes, but it's really uncomfortable when that happens. So it wakes me up every time it happens. And then of course I have to use the bathroom, so that's fun. And then you're awake, and it's hard to go back to sleep. So that's what I was experiencing last night. So I didn't get much sleep, so I'll probably go to bed early tonight. I feel okay right now, weirdly enough. I'm tired, but I'm not like I need to go to bed right away. So that was last night, and that was not fun. So would not recommend if you can avoid that. But so the day after chemo, you take steroid meds again. And then I also get a white blood cell booster shot, because after each chemo session, your white blood cell count drops drastically. Because what the chemo is doing is it's killing all cells in your body that grow. That's how it kills the cancer cells, because they're growing. So but it doesn't kill cancer specifically. It kills all cells that grow, which is why you lose your hair. For some chemos, not all, but for mine in particular, that's how you lose hair. And so my white blood cell count drops. And that will last anywhere from 7 to 10 days until your body can regenerate those a little bit better, and the chemo starts to kind of dissipate a little bit, and it's not quite as strong. But the white blood cell count booster shot helps with that. So it kind of helps your body make more white blood cells. And so if I were to get sick or have an infection, I can fight that off a lot easier. If I didn't have that, and say I got a cold even, I could be in trouble because my body wouldn't be able to fight it off. So that's why you get that. And that shot, even though it's like the less invasive part of this whole procedure, because it's super small needle, even smaller than a flu shot needle, not that bad, takes 15 minutes usually, does make you feel a little like just kind of yucky afterwards, kind of similar to a flu shot, where you just, I don't know how to describe it, you just feel kind of gross. But it is what it is. So the following day, the steroids kind of keeping the major symptoms at bay. The nausea medicine still doing its job from the day before. White blood cell count, booster shot making you feel a little gross. Today I'm kind of experiencing a very slight headache, tired because of the night before, fatigue as far as like your body just feels tired and weak. And so far it hasn't really affected my appetite too much the week after chemo, so I'm usually eating pretty well at this point, and I think the steroid helps with that. And then Thursday, Friday, I'll kind of be experiencing similar symptoms as I am today, just kind of just dealing with the chemo running through the body, still feeling a little brain fog, hard to concentrate, kind of lingering symptoms from that. But then, over the weekend, I'll get off the steroid, because Thursday and Friday, since I was having kind of allergic reaction where my face would get red or swell up if I wasn't taking the steroid after chemo, then so I've been taking it a little bit longer than what most people do, but I decided that's the longest I should go. Steroids are also not good for your body, so I decided with the permission from my oncologist that I would not take it any longer than that. So over the weekend is when I'm going to start to feel my worst, because the steroids will be out of my system. I'll still be taking some probably allergy medicines to help with any sort of lingering allergic reactions I might have. But I'll be feeling pretty bad, because then the symptoms I'm not experiencing now will start to flare up. And these are some of the things that I experience. So I get pretty bad headaches, which is what I use my cold cap for to help with that. I've tried Tylenol, I've tried ibuprofen, I've tried all the pain meds over the counter that help with pain. They do nothing for this headache, but the cold cap works. And then the worst symptom out of all the things I experience are the burning sensation in my stomach, esophagus, and mouth. Kind of feels like extreme heartburn is the best way to describe it. But with my mouth, it feels like I drank burning hot chocolate and my mouth is just extremely sore and burny from that. That's what it feels like. So food is not fun during that time, especially over the weekend during the chemo week. So I'll be experiencing that this weekend for sure, because that's been pretty consistent the last chemo sessions. Also experiencing digestion issues, so both blue stools and constipation, and that happens all the time, randomly. It'll be worse this weekend and next week, but that's a consistent thing off and on for the entire chemo situation. For this weekend and all of next week, I don't really feel nauseous, but I don't really feel hungry, so I have to make myself eat, and I try and eat foods that are easy on the stomach, not too harsh tasting, so it doesn't give me extreme weird texture feelings or anything like that in my mouth. So shakes are a good thing to turn to, so that's what I'll be experiencing this weekend and a little bit next week. And those are kind of the main ones: headache, constipation issues, and the heartburn. And the heartburn is worse at night than it is during the day, probably because I'm trying to lay down. So there's that. Trying to think if there's any other symptoms I experienced really during that time. My face might swell a little bit, might get a little red, which is what the steroid shot steroid medicine is helping me with today, Thursday, and Friday. But once I'm off the steroid, that might happen a little bit, and I've experienced that. I'm trying to think I think those are the main symptoms that I experienced during that time. Next week, I'll be still dealing with a lot of those symptoms off and on. Feel very, very fatigued. Feel still brain foggy. Hard to concentrate. Headache. Aversions to food. The heartburn. Constipation. Blue stools. All of that. will happen next week, off and on, here and there. So I'll be dealing with those issues, and that's been pretty consistent throughout the whole treatment. And it gets worse every time I do a new treatment, every session. And then and I also have been experiencing some pain in my chest, which is why I'm seeing the cardiologist tomorrow, and I'll get to that in a little bit. But so that's been a little bit of a concern, where I'll feel kind of achy in my chest. And I've been trying to tell myself that it's probably just a muscle deal, but I'm kind of wondering if it's heart related, so we'll check that out. Something else I forgot to mention is joint pain and muscle pain, and that, again, off and on, so it's not a consistent thing, and I believe that is due to my red blood cell count being low, because, again, the chemo kills all growing cells, and so my hemoglobin is low. I'm going to start being more consistent taking my iron to help with that. But when your hemoglobin is low, then your blood's not pumping oxygen through your body quite as well as it's supposed to. So that makes my joints and my muscles feel achy. So that's something else I'll experience this weekend and next week as well. I forgot to mention that. And then the third week, the week before my next chemo, usually I'm feeling pretty good. By pretty good, I mean I'm not experiencing those symptoms that I just described quite as much. They'll still be there sporadically. But that's the week when you feel, or at least I feel, most close to normal. Still very fatigued at times. Still mild cases or random cases of the symptoms I just went through. But feeling pretty good. Unfortunately, though, that's the week when my chemo rash pops up. So body feeling okay, but then I have to deal with that. So what happens with that is on my head and on the back of my neck, sometimes on my back and shoulders, sometimes on my chest, sometimes even on my face, I will have little rash bumps that are pretty painful. They look like blisters. Sometimes they resemble acne, depending on, what my body's doing. And there's really, honestly, no treatment for it. I've tried everything. I have several ointments that help if it's itchy, like a rash, which it does sometimes. But as far as treatment goes, as far as curing it or making it go away, there's nothing you can do. So I just I keep it clean when it pops up. I wash those areas at least twice a day, if not more, just to make sure it's not getting infected or anything like that. So that's a fun thing I deal with during the third week. And it usually lasts at least a week, if not more. And then it goes away by the last weekend before my next chemo treatment. Usually starts to go away and heal up. And that last weekend is usually when I'm feeling the best, right before my next chemo, where the rash is pretty much gone. Very little to no symptoms, except for maybe the fatigue, sometimes the headaches, heartburn a little bit here and there, but not too bad. Still doing hot flashes. Hot flashes have not stopped since they started about, during the third treatment or so. So that's still something I deal with. But then it starts all over again, and then you do the next treatment. So that's what I've experienced so far. I believe I haven't missed anything, but if you have any questions or comments, please feel free to ask. And it's different for everybody, but if you are ever wondering about things that you might be going through, if you have to go through this at all, or if you did go through this and had similar experiences, feel free to share. But like I said, it's different for everyone. So the cardiologist visit, I wanted to mention that. So I have to go in tomorrow to see the cardiologist. I had 2 echoes done. First one was back in June before chemo started. Second one was last week. And I don't know, I'm not a medical person, so the best thing I can say is the numbers went down a little bit. The numbers that should be where they are went down a little bit from where they are during the echo test. That's the best way I can really describe it, because I'm not a medical expert. And so my oncologist thinks that I should go see the cardiologist and see if there's anything we need to adjust with the medicine or my treatments for the last little stretch here, or if there's anything additional I need to do after chemo to help with any heart-related issues I might have. So, according to my report, and I don't have the terminology right here in front of me, but from what I've researched, Google search, I believe I have a mild form of heart failure. Not to freak anybody out or myself. And when I asked my doctor if I should be super concerned about that, he didn't act like he was really all that worried. I don't know if that's just doctors speak or tone of voice trying not to freak me out, but I'll know more tomorrow. So I'll tell everybody on here what comes of that appointment, if I need to do any further tests, whatever the case may be. But heart failure can be a symptom of chemo. I mean, the chemo drugs are going directly into your heart. For me, for my procedure, that's not true of everybody, but for me, because it pumps it to the rest of my body to treat the cancer throughout my body where it's needed. So, and that's hard on your heart, and it's a toxic medication for your heart. So the fact that it affects your heart at all is honestly kind of to be expected a little bit. So hopefully I don't have to do anything further with that, but we'll see. I will let you know. So my last treatment for chemo is the 28th. I will have to do what's called 2 more labs, and that's something I forgot to mention. So every week I have to do a lab. They draw my blood, check my vitals, check all my levels, see if everything's going okay, all of that. So I'll have 2 more labs after my last chemo, and at some point I'm sure I'll have to do more tests before my surgery. So my surgery will be a double mastectomy. They usually say I'll have to wait a month to a month and a half before I can even do the surgery to have my body heal from the chemo before it's strong enough to handle surgery. So I'm guessing my surgery will be December, January, if we go by that timeline. The recovery can be several weeks from my understanding. How long that's going to be or what the recovery looks like, again, probably different for everybody, but I'll keep you updated and see what that's going to be like. But I know I'll have to have drainage tubes attached to me for a while after that procedure that I'll need to monitor my fluid drainage from my incision and from my surgery. So that's something I'll have to consider, and I'll keep you updated on what that's like later on. And then my oncologist said after the surgery, and depending on whatever the tests show, however well the surgery goes is going to determine what my treatment will be after that, with my immunotherapy, and if I need to do any sort of additional chemo or anything like that will be determined later on. And that treatment for sure will last at least a year, and that's to prevent my HER2 from mutating any more cells into cancer cells, is my understanding of what that's going to be like. Hopefully it won't be too long a procedure per treatment. They say a couple hours at a time every 3 weeks, kind of like my system now that I got going on. So just another thing to add to the treatments. But from my own standpoint, this is the best I can do to describe the feelings that I go through and symptoms I experience while chemo is going on. And again, different for everybody, but that's what I've experienced so far. It's not fun. I try and do it with as much grace and understanding and everything that I can, because I'm trying to live as close to a normal life as possible, and that's hard when you're feeling like crap. But so far I've been working as much as I possibly can with everything I have going on. So far I've only taken off days when I've had appointments. I haven't taken off any days when I've felt terrible to stay. So far I've been pushing through, because as you know, as a teacher, when you have to make sub-plans, you're going to probably push through the best that you can, because writing sub-plans is the worst. But I had to do that for tomorrow, for my appointment. But yeah, so that's what I've experienced so far. If you have any questions, feel free to ask. And I hope you have a good day. Oh, by the way, future video coming up, where I'll be sending out some thank yous for people who have helped me so far along the way. So stay tuned to that.